Okay, so we'll move toward the next slide. We're just going to go over our norms, and then we'll have Ms. Gabriela present, and then questions and answers at the end. It's okay to mute your mic. This meeting is recorded, and we'll be sharing it through our website on YouTube. And Ms. Gabriela, go ahead.
Hello, good afternoon, everyone. My name is Gabriela Gomez. You can call me Gabby. I am with the LA County Department of Public Social Services, and I am here today to share some information with you about the various programs that DPSS administers. Next slide, please. So I just want to thank you for being here today. And, for some of you, this may be the first time that you're hearing about our programs. Maybe first time that you're considering to apply for our programs. So I hope that you find this information useful. Next slide. Thank you. So, this year, as we have said before, has been like no other for various reasons, mainly because of COVID. We've had to change our operations. We've had to sort of pivot the way that we do our business, as has your school, as have so many other businesses. And so with that said, we're trying our hardest to make sure that everyone receives the help and the benefits that they are eligible to. So we need your help to spread the word about the programs that DPSS has to offer. And I hope you find this information helpful. Next slide, please. So as we were saying before, COVID has impacted households in LA County like nothing else. We've been through wildfires, we've been through earthquakes, we've been through drought, we've been through so many things, nothing like COVID. At this point in LA County, we're seeing nearly 1 million people who are unemployed, and 1 in 4 households lack access to nutritional food. To nutritious food, and not only is it a lack of access, but families right now are being really tested in terms of having to make difficult choices. Do I pay for my rent? Do I pay my gas bill? Do I put gas in my car? Do I pay my car insurance? Do I pay my health insurance? Or do I buy food? And so, that's why we're here, to help make some of those choices a little bit less difficult. A lot of our essential workers, we have a lot of essential workers, folks that are working in our, meat packing facilities, our food, particularly in our food production sectors. A lot of them don't have access to affordable health care. A lot of our drivers, our DoorDash drivers and Lyft drivers and people that are delivering our food so that we don't have to go out. A lot of our grocery store workers, that are still there, they don't have access to healthcare. So we want to make sure that everybody has access as much as possible. Next slide, please. So LA County Department of Public Social Services, known as DPSS, we administer federal, state, and county funded programs for people in need. And the needs can vary from financial assistance to food nutrition benefits, healthcare coverage, and training and job placement assistance. And there's a lot more than that. We have a lot of other programs that can help with homelessness, with childcare. There's so many other programs that we offer, but these are the main 4. And under the umbrella of these 4, you will find a lot of other benefits and services. So our mission is to enrich lives through effective and caring service, and that's our goal. At this point, there have been so many people that have been affected by COVID that they may be considering applying for benefits for the first time ever. They really don't understand how to navigate the system, or they don't perhaps know what benefits are available to them. So we're going to go through that rather quickly. And if you have questions, please let me know in the chat box, and we'll address all of your questions at the end. Next slide, please. So DPSS is the largest public social service agency in the country. We serve 1 out of every 3 residents in Los Angeles County, and we have a workforce of nearly 14,000. At this point, it says 13,800 on the slide, but we recently hired a lot of workers, so I think we're closer to over 14,000 at this point. We can serve the public in, it says there are 19, we have 9 threshold languages staffed in our department. We have a group called our Civil Rights Translation Section, and so we are able to translate documents, forms, any kind of information that we have into 9 different languages, but we also have access to translation services for more than 9 languages. So if anybody comes in and there's a language maybe that we don't have in the office that we can't accommodate, we can always fall back on our resources to help with translation. So we can help anybody, whatever language you speak, help is.
Miss Gabriela? You might have a little technical difficulty. Okay. It might be that her internet got cut off. So far, are there any questions regarding this information? You can brainstorm on a question. We can add it in the chat. All right, she's coming back. Hi, Miss Gabriela. We see you, but you are on mute. If you're using your phone.
There it is. Okay.
There you go.
Now?
Yes, we can hear you.
Okay, great. Okay, so sorry about that. My
No
computer
problem.
died all of a sudden. So now I'm on my phone.
Thank you.
But now I can't really see the PowerPoint because it's a little bit small. So let me see if I can pop that open. And so I can
You can actually zoom in using your fingers.
Yep. I'm working on that right now. Let me, I can't turn myself sideways. So, okay, so let's go back to the previous slide.
Sure.
Sorry about that, folks. Technical difficulties, but we're back. So as I was saying, DPSS is the largest social service agency in the country. And currently, as I was saying, we hired a bunch of new workers, a lot more new workers. So we're closer to 14,000. And we can serve you in as many languages as you need. Next slide, please. And as you can see, this chart shows what the majority of our caseload is. Most of our cases are Medi-Cal related cases, meaning that most of the people that we serve are people who have applied for Medi-Cal, who are receiving Medi-Cal benefits. They may not be receiving CalFresh, they may not be receiving any cash assistance, but they are receiving Medi-Cal. The next largest group of cases that we have are people who are receiving CalFresh. And in case you don't know what CalFresh is the new name, well, not necessarily new, it's been around for about 10 years, but people know it as food stamps. So CalFresh, that's what we call it in California. And that's our next biggest caseload. Again, maybe not necessarily people who are receiving cash aid, but who are receiving food benefits. Maybe they're working, they're working and they make enough, just barely enough to not qualify for cash aid, but they still need some help with food benefits. So that's our next biggest caseload. After that, we have CalWorks, which is cash aid for adults with dependent children. We have General Relief, which is for our adults who are 18 and over with no dependents. Then we have our, let me see, our CAPI program, which is, our CAPI program, which is assistance for immigrants who are not eligible for SSI or SSP. They are legal residents or legal immigrants, but they do not qualify for SSI or SSP. They may be elderly or have some disabilities. And we also have our refugee cash assistance program. So this is for our refugees who have been in the country for at least 8 months. And we can provide some cash assistance to them as well. Next slide, please. So the information that I'm about to share isn't just financial assistance. It's we will talk about our cash programs, but also we'll talk about some of our other programs that have to do with housing assistance and healthcare, and our food assistance program. Next slide. Next. Okay, there we go. So as I was saying before, our CalWorks program provides financial assistance for families with dependent children. This could be families who have children or who are expecting children. Maybe in the third trimester, I believe it's that they can apply for CalWorks benefits. And the benefit that they receive, the cash aid that they receive, really does help to pay for their rent, their living expenses, and it is based on family size and income. Next slide, please. Also, our CalWorks housing programs. A lot of people are not familiar with our CalWorks housing programs, but if you are currently receiving CalWorks and you are at risk of becoming homeless, or you become homeless, if you are behind on your rent, we have several programs that can help. The program that we are pushing right now a lot is emergency assistance to prevent eviction. As you are aware, there has been a moratorium on evictions. I believe that's set to expire. There's some talk about it maybe being extended, but at this point it's set to expire this month. So if you are receiving CalWorks benefits and you are behind on your rent, please, please, please call your worker, call our customer service center, and ask about the emergency assistance to prevent eviction program. At this point, for persons who are trying to access that program for the first time, I believe that we can help with up to $5,000 to pay past due rent. So please, if you are in need of help, let us know. If you are currently homeless and you are in need of shelter, we have our homeless case management program, and they can help you to identify a shelter, transitional housing. If you find permanent housing and you need some help to pay for your move-in costs, such as security deposit, we have programs that can help with that too. So please, if you need help, give us a call. Next slide, please. For general relief, our general relief program is, as I was saying before, for our adults who are over 18, who don't have any dependents. And, general relief benefits are funded with county money only. It isn't a whole lot of money. I believe right now it's $221 a month. That's really the last recourse for a lot of people. If they run out of unemployment benefits, if they've run out of other benefits, general relief can help. Typically, people who are eligible for general relief can also receive CalFresh benefits and Medi-Cal benefits as well. So that is, as I said, through our county funded program. And there's also the GROW program that can help them to find a job or get some training to prepare for a job. So that comes along with GR. Next slide, please. Our cash assistance program for immigrants provides cash assistance to certain age, blind, and disabled immigrants, and who are not eligible for SSI or SSP benefits. So we do have some assistance available for them. And you can find more information about that on our website. Let me see. Our refugee cash assistance program, that again is for refugees who have been in the country for at least 8 months, and we can provide some assistance to them. And these are our refugees who are not eligible. I'm sorry, refugees who are receiving CalWorks or who are receiving SSI are not eligible to receive RCA benefits. There's no double dipping there. So If they are not receiving CalWORKs and not receiving SSI, then we can help them with some cash assistance. They can also get Medi-Cal and CalFresh. And just so you know, our RCA program is more than just providing cash assistance. We really do help our refugees, get used to their new life in the United States and in Los Angeles County. They don't typically know how things are done here, and so we do try to help them to acclimate to their new environment. Next slide. Our nutrition assistance program, right now, as we were saying before, in LA County and really throughout the country, people are having a really hard time accessing nutritious food, and they're having to make really difficult choices. So we're trying to ease some of that difficulty through our CalFresh program. Next slide. Our CalFresh program is really helping to fight food insecurity in Los Angeles County. And the way that we're doing that is by making sure that people can access their nutrition benefits that they can use to buy their food at the grocery store, at farmers markets. And now we've even added online shopping. So if everybody's staying at home right now trying to stay COVID free. And so if you are worried about being out there and going to a grocery store, and you'd rather stay safe at home, you can now shop online at Albertsons, Vons, at Safeway, Walmart, and on Amazon. With Walmart and Amazon, you have the option for delivery, but please note that delivery fees are not payable through CalFresh benefits. You would have to pay those through either cash or through your cash benefit. But you can also schedule curbside pickup with Albertsons and Vons and Safeway. So you can shop online now with CalFresh, and if you shop at our local farmers markets, ask about the Market Match program. For example, if you spend $20 at a Market Match farmers market, you can get a voucher to match you up to $10, $20 depending on the voucher that market is offering. So you can oftentimes double your money and get more for your CalFresh benefits at the farmers market. And it also helps to support our local farmers and agriculture. So everybody wins. Next slide, please. Our current budget allocation for CalFresh is $89 million. We have approximately 2 million enrollments in CalFresh and a retention rate of 40%, meaning that people who get CalFresh typically stay on CalFresh because it's a real help to their budget. Next slide. Our healthcare programs, as we were saying before, a lot of our essential workers, a lot of our low wage earners, a lot of folks just don't have access to healthcare. So that's what Medi-Cal is for. And you can apply for Medi-Cal online. You can apply, you can call us at our customer service number, and we can help get you enrolled in Medi-Cal. Typically, insurance programs have a deadline for enrollment. Medi-Cal does not have a deadline for enrollment. You can enroll at any time of the year. And a lot of folks who perhaps were receiving insurance through Covered California, maybe they lost their job and they're no longer able to pay those premiums, they may qualify for Medi-Cal. So you may be transitioned over to Medi-Cal in Los Angeles County. So if you have any questions about that, we're more than happy to answer your questions at our call center. And in-home supportive services. So our in-home supportive services program helps our elderly and disabled people to stay in their homes by providing them with the support that they need in terms of having someone there to help them with their errands, to help take them to their appointments, to help them with any personal care needs that they have, maybe cooking, that kind of thing. So it's really nice that we can provide that service, because a lot of folks who need that kind of help, may not be able to stay at home. They might end up in a nursing home, and a nursing home is probably not the best place right now. So we really want to make sure that folks who are eligible for the IHSS program, that they enroll and that they get the help that they need so that they can stay in their homes. And as you'll see on the screen there, we have phone numbers where people can apply for IHSS. Our IHSS providers, which are the care providers, they are now eligible to complete all of their time cards and receive their payments. Everything is done online or over the phone. They can get direct deposit to their accounts. So we've really streamlined the way that we're providing services now. Our social workers who help our IHSS customers out, they are still doing home calls. To the extent possible that they can conduct business over the phone, they are conducting business over the phone. But in the event that they do need to go out to someone's home, they are definitely going out making home visits, and they are following all COVID protocols. They wear their masks, they maintain their distance, and they do everything that they can to make sure that they stay safe, as well as keeping our customers safe. Next slide. Our welfare to work programs. So our welfare to work programs help our GAIN participants and our GROW participants to get the training that they need to complete their educations that they need in order to find a job. Our Greater Avenues for Independence program is for our CalWorks customers, people who are receiving cash aid. They have dependent children. And our GAIN program, as I said before, they can opt for training, or if they're ready to work, we can help them to do job searches, find a job. We can provide childcare support for them. If there's any kind of mental health support that they may need, if there's a domestic violence situation or a substance, use disorder, we can provide resources for that to help them with that, because the whole point is for them to become independent and make their way through life and provide a better life for themselves and their kids. So our general relief program is also, like I was saying before, for our GROW program, is for our general relief participants, to help them also to get the training they need and job placement that they need to help them build a better life. Because it's nice that GR is there, but it's not enough to really live on. So we really, really do encourage anybody who's receiving GR benefits to participate in our GROW program and to find better opportunities for them. Our refugee employment program, that's also an employment program for our people who are receiving refugee cash assistance. And that's where we also help them to really acclimate to living in a new country, to help them find work and to help get them on their way with living in Los Angeles County. Next slide. So we also have our DPSS mobile app. If you need to check your benefits, if you need to upload any documents, if you need to, find out what your the status is of your case, you can download the DPSS mobile app from the Google Play and Apple Store and have that information on your phone at your fingertips. You can access YBN to check your notices. YBN is our Your Benefits Now application website, and that's where you can log in. If you're on your desktop or laptop computer, you can log in to download all of your notices. And people who receive benefits from us, they receive their benefits on what's known as an EBT card. It's an electronic benefit transfer card, and that card can be used pretty much the way that you would use any ATM card when you go shopping, when you go to the store. Next slide, please. And our contact information, if you need to call us, if you have any questions, you can call our customer service center at 866-613-3777. We have expanded our hours. So our customer service center is now available from 7:30 in the morning to 7:30 at night, Monday through Friday, and on Saturdays from 8 a.m. to 4:30 p.m. You can also check out our website at dpss.lacounty.gov, where you'll find more information about all of our programs. You can also check out our events calendar, where we upload all the different events that are going on in the community that can possibly help you. We have all our announcements on there. So please check out our website. Next slide. And finally, I really do urge you all to follow us and subscribe. Follow us on social media. We're on Facebook, Twitter, Instagram, and YouTube. And the reason why I really do encourage you to follow us on social media is because that is where we put up all of our announcements of things that are going on in the community, whether it's a food distribution, a toy giveaway, a housing opportunity, a job opportunity, all the different things that all the different resources that can help you to, fulfill your needs, whether it's a job, whether it's food, clothing, anything like that. Just follow us on social media and you'll find all of this information. We also have our email newsletter that you can receive if you subscribe at the address is right down there. We had to shorten it. It's a bit.ly, DPSS emails. So subscribe and you can get all your information from us in an email, all of our announcements. And if you check out our YouTube channel, you will find a lot of videos on there, instructional videos that show you how to apply online, how to download your notices, how to find your worker information. There's videos on there about our IHSS program. So please check out our YouTube channel, subscribe to our YouTube channel so you can get notices every time we put up a new video, a new informational video. And I know I went through it kind of fast, but that's all I have for today. If you have any questions, I'll be more than happy to answer them.
Thank you so much, Gabriela. Yeah, if you have any questions right now, this is a time, or if you would like to call me or text me with them questions and we can get them communicated to Gabriela. So if you do have a question, feel free to unmute your mic.
Okay, I have one.
Yes.
We're on LA Care right now.
Mhm.
Okay, my son will be turning 18 in February. Will that affect him?
What, turning 18?
Yes.
Honestly, I don't really know the eligibility details for Medi-Cal. But if you send me an email or you send your question to Maritza, I can get in touch with you and we can have somebody help you out to answer that eligibility question.
Yeah, because he won't be 18 until February, and he'll still be living with me because he'll be in school still.
Yeah, I think he should be okay because I know that Medi-Cal, I think he's eligible, and don't quote me on this, and this is why I don't like to give eligibility information because I'm not an eligibility worker, but I believe that they can still be covered up until their 19th birthday. Because Medi-Cal was expanded with the Affordable Care Act. Medi-Cal was expanded to include people from ages 19 through 64. That population wasn't eligible before until the Affordable Care Act. So if he's going to be 18, I think he should be okay. But like I said, don't quote me on that. Go ahead and send your contact information to Maritza, and she can get that information to me, and we'll try and get an answer for you.
Okay, if not, maybe I can just call LA Care then myself and find out.
Sure.
Okay, because this is also scary to me right now.
Yeah, I know. It's really stressful. And like I was saying before, there's a lot of folks out there that have never applied for any kind of benefit before. They really don't know the ins and outs, and it can be confusing and it can be a little bit overwhelming. But our customer service center is there, and that's our number there. So they can answer any questions that you might have. But yeah, definitely give LA Cares a call so that they can give you some more detailed information regarding your specific case.
Okay, thank you so much.
You're welcome.
And Barbara, I also put the local phone number for the customer service there. Sorry, I can't. Customer service center. Right? It's 626-569-1399. 626-569-1399. But feel free to reach out to me with your question as well, so I can direct it to Ms. Gabriela so we can get you the answer you need if you're not able to with the phone number that you have.
Okay,
thank you. If you have any other questions, we are also at the end of our presentation, but feel free to contact me. Thank you so much, Ms. Gabriela, for your time, your presentation, even the technical difficulties. You did wonderful.
I'm glad we were able to get back on.
And just as a reminder, today at at 6 p.m., we have our mental health and stigma workshop at 6 p.m. The links for that are on our school calendar, on the district calendar. You should have received a text message on Tuesday as well for the link for that. And if you don't have it, feel free to give me a text or give me a call and I'll send it to your phone. And winter break reminders from December 24th till January 12th. Winter break, December 24th till January 12th. So our next Cafe Azteca will be Thursday, January 14th. And if you have any questions, feel free to reach out. Thank you so much, everyone, for being here.
Bye.
Bye.
Bye.